welcome to our special show on International Epilepsy Day. I'm Gargi Rawat. Epilepsy is a chronic, non-communicable disease of the brain that affects people of all ages. It's one of the most common neurological diseases globally. Around 50 million people suffer from epilepsy, but many of them suffer silently, many of them suffer alone. Beyond the suffering and beyond the absence of care lie the frontiers of stigma, shame, exclusion, and more often than we care to know, death. The diagnosis of epilepsy leads to a considerable number of negative psychological effects, especially for children going to school, as they're severely discriminated against in the school environment by their teachers and even classmates. Developing countries lag somewhat behind in epilepsy education, making it even more difficult to live with the disease than the disease itself. Judgment and lack of information about the condition can also create more obstacles for members of the epilepsy community. It's important to raise awareness about the condition because it can be handled better if it's diagnosed early and then treated right. Today on International Epilepsy Day, we have with us eminent neurologists who can help you understand epilepsy diagnosis and management better. Let's introduce our panel of doctors. Dr. Professor Manmohan Mehndiratta, President, Indian Epilepsy Society, Vice President, International Bureau for Epilepsy, Southeast Asia. Dr. Chaturbhuj Rathore, Senior Neurologist, Zydus Hospital, Vadodara. Dr. Amit Haldar, Director of Neurology, Fortis Hospital, Anandapura, Kolkata. Dr. Sangeeta Rawat, Dean, SATE, GS Medical College and KM Hospital, Mumbai. And Dr. B. Vengama, Director cum Vice Chancellor, Professor, Senior Grade, Department Neurology, President, Indian Epilepsy Association, Tirupati. And Dr. Lakshmi Narayanan, Senior Consultant, Pediatric Neurologist and Epileptologist, Advanced Center for Epilepsy, Gleneagles, Global Health City, Chennai. Well, thank you so much, doctors, for joining us today on the program and, to create more awareness about this very important issue. Dr. Mehndiratta, I'd like to start with you. If you could please tell the viewers in simple terms, what is epilepsy and what causes it?
Thank you so much. Very good afternoon. Epilepsy is defined as when the seizures, or in layman language what we call fits, happen repeatedly. If there are more than two, only then we call it as epilepsy. In Hindi we call it as only upsmar, but in English there are many types of seizures, and these seizures, when recurrent and unprovoked, at that time we label it as epilepsy and investigate accordingly to find out the cause and appropriate management.
All right, Dr. Rawat, what are the different types of epilepsy? If you could explain to us what different symptoms do patients with epilepsy have?
Good afternoon. Basically, epilepsy, it's an abnormal electrical discharge which starts in the brain. So if it starts in the whole brain, it is present as a generalized seizures, and patient lose consciousness and a big tonic-clonic fits with uprolling of eyeballs and incontinence of urine, tongue bite, and that happens. Or sometimes it may be just the blinking of eyelids or a jerk of the hand. Other type is a focal seizure where the electrical discharge starts from one part of the brain and then the patient is aware about it. When it spreads to the other part, patient loses awareness but doesn't become unconscious. He is unaware and partially confused. So in this, the symptoms start with an aura where the patient is conscious and can remember that it may be arising from the area which is the first where the electrical discharge starts. So it may be abnormal smell, it may be abnormal feeling in the stomach, or it may have just a flashes of light or abnormal picture or a deja vu. And then when it spreads further to the respective lobe, it may have a confusional behavior, staring episode, behavioral arrest. It may have you have an emotional continence, smiling, kissing, spitting, laughing. So the various symptoms occur as per the lobes of the brain which is involved. It may be just flashing of the jerking of the face or jerking of the hand also. So there are various types, but in one patient, usually the same type of symptoms occur in each episode of seizure.
All right. Dr. Haldar, so now can you explain to us how epilepsy is diagnosed and what are the different tests required for the diagnosis of epilepsy?
Epilepsy is diagnosed based on clinical history. Since the person may not be able to describe the event, an eyewitness of the event is of utmost importance. That eyewitness can tell us where the event occurred, how the event occurred, and what happened after the event. One should specifically ask for tongue bite or urinary incontinence or any injuries suffered. The examination of the patient is of utmost importance. And another thing is you have to exclude other causes of loss of consciousness. For example, hypoglycemia, low blood sugar, and cardiac arrhythmia needs to be excluded. But the main investigations that one should do are MRI of the brain and EEG. EEG, electroencephalogram, records the electrical activity of the brain, and they can be abnormal in seizures and can be helpful in the diagnosis of epilepsy. There are further tests like PET scan, MEG, and other things which can be used only in selected cases.
Right. Dr. Rathore, if you could now explain to viewers, do all patients with seizures require treatment, and what is the treatment for epilepsy?
So, very good afternoon. Once we diagnose the type of the epilepsy and confirm that patient has epilepsy, the treatment with anti-seizure medicine is the mainstay of the epilepsy treatment. However, all the patients may not require treatment. Patients who have immediately treatable cause like seizures due to the low blood sugar, they may not require long-term treatment. Rest of the patient will require long-term anti-epileptic drug treatment. There are more than 20 drugs are available for treatment of the epilepsy, and we choose medicine depending upon the type of the epilepsy and certain patient-related factors like gender of the patient and age of the patient. Usually we start with one medicine in the lowest possible dose and we titrate the dose depending upon the seizure control. If the patient is not getting control with one medicine, sometimes we might have to change the medicine or add another medicine. With this type of treatment and with one or two medicines, seizures can be controlled in approximately 70% of the patients and who can lead a completely normal life. In another 30% of the patients, we might require another set of the medicine, or sometimes we can offer epilepsy surgery. So this way the epilepsy is treated, and usually patients require a treatment for a longer duration, maybe up to duration of 3 to 5 years.
All right. Dr. Vengama, if you could now tell us, since we spoke about how medicines are needed for the treatment, are epilepsy medicines safe, and what are the common problems associated with anti-seizure medicines?
Yeah, most of the time the seizures will get controlled with anti-seizure medications. Out of the 20 drugs, the side effects profile depends upon whether it is an older generation drug or a newer generation drug, or it depends upon the dose of the drug, type of the administration, as well as the length of the duration, or if they have an associated comorbid conditions like diabetes, hypertension, and they have other medications. Usually if you start at a high dose, sometimes they may develop side effects, and then as the time passes, if the body gets adjusted to the drug, the side effects will come down. That's why the dictum to avoid the side effects is to start at a lower dose and slowly increase so that the body get adjusted to the drug and side effects may not be there. The newer drugs also are there, but compared to the older drugs, the side effects are little less and they are mild. But whatever the side effects, the moment you reduce the dose or stop the drug, majority of them disappear. Unless it is a long-standing, very few side effects may remain.
All right. Dr. Lakshmi Narayanan, how long then does one need to take these medicines? Now, it's a common perception that epilepsy patients require lifelong treatment. Is this correct?
No, we know that epilepsy is not a single disease. Rather, there are many different types of epilepsies. So, obviously, the treatment decision will be individualized based on the epilepsy type. Say, for example, many children with epilepsy outgrow their disease over time. So, we give anti-seizure medications for most children with epilepsy only for up to 2 to 5 years. On the other hand, there are many different types of epilepsies that need slightly longer term anti-seizure medications. For example, juvenile myoclonic epilepsy, epilepsy. These are some of the epilepsies that may need many decades of long-term medications to control the disease. Having said that, most patients would not require lifelong treatment. and the treatment decisions will be individualized. So the patient needs to follow their treating doctor's advice.
All right. Well, thank you for that. Time for us to slip into a short break. We have many more questions for the doctors. Do stay with us. Welcome back to our special show on International Epilepsy Day, where we have a panel of doctors answering all our questions. Let's go back to them. Dr. Mehendiratha, if you could tell us, what are the options when seizures are not controlled with medicines? Can you tell us something about epilepsy surgery?
There are very good medicines available. In India, there are more than 20 medicines available, except 2 or 3 which will soon arrive. They are very economical. They are much cheaper than in the Western world. If these medicines are not in a position to control the seizures for 2 years, 2 medicine, maximum dosage, in that situation and patient is taking treatment regularly, we can think of surgical options. The surgical options require admission in the hospital, pre-surgical evaluation detailed to find out from where the epileptic focus is there or the discharges are arising. Once that is localized, we take out only that focal area so that there are no side effects or no effect on the memory, speech or power of the patient. And after that, the dosage of medicine can be reduced over a period of time. Thank you.
All right. Dr. Rawat, if you could tell us what precautions should a patient take to maximize the chances of seizure control?
Yes, Gargi, basically this epilepsy is a chronic disorder and requires medication for a long time. So the important part is that patient should be well motivated to have a good compliance. So good compliance means you keep a seizure diary and you write whenever you have seizure, because you may tend to forget when you go for follow-up. And then at regular follow-up with 3 to 6 months with your neurologist, carry that diary so that they can advise you properly on the drug. Also, you might have to do the blood levels of your drug intermittently. Apart from this, there are also pill reminders which you can put up in your mobiles. Then there are certain trigger factors like lack of sleep you may have, which may precipitate the fits. So always late night of mobiles, late nights of your digital media, it is not advisable for this. You should avoid fasting, especially in the people who do roja. We see many patients coming after that having epilepsy. So fasting, lack of sleep, and also in certain patients you may have a flashes of light or photosensitive epilepsy. So there you avoid that. And one important reason in the woman with epilepsy is that it may increase around your menses, which is called as a catamenial epilepsy. And when it increases around that, if you recognize that pattern, tell your doctor and they might give you additional dose of anti-seizure medication during that 7 days or something, which will control this catamenial epilepsy.
Right. Dr. Haldar, now if we can talk about what are the common myths associated with epilepsy in the community and how can we remove the stigma associated with it?
It was believed that some spirit took possession of the mind, and that led to a lot of stigma associated with epilepsy. People with epilepsy were considered to have unsound mind or intellectually inferior, and they faced discrimination in education, in work. Even it was believed that people with epilepsy could not marry and have children. Even in play, they were discriminated against. But this is totally false. Most of the patients with epilepsy are as intelligent as any of us. They can work normally, they can marry, have children. Even a person who has epilepsy, if his seizures are well controlled, can drive. Whereas, unfortunately, in India, we do not have any regulation for this, but this needs to be looked into. The most important thing in epilepsy is that epilepsy is not contagious, and a person with epilepsy can be a friend just like anyone else.
Absolutely. There needs to be more awareness and education as well. So, Dr. Rathore, what measures should a bystander take if a patient has a seizure? What first aid can be given?
So many people in community or even the patient's relative may encounter a patient having a seizure. So the first and foremost advice is for them will be to do not get panic. Usually people get frightened seeing very violent movements and the patient becoming unconscious. But please remember that 99% of the seizures do not last beyond 1.5 to 2 minutes. And the second thing which they can do is to prevent the injury to the patient by removing any sharp objects from nearby to the patient. There is a common myth that people usually put some spoon into the mouth. So advice is do not put anything into the mouth of the patient except probably a soft towel or a napkin to prevent the tongue injury. Finally, do not restrain the patient and do not try to control the movements. Movements will stop within the next 2 minutes. And once the movements stop, one may try to shift the patient to a sideways position and may wipe the saliva. Also remember that if the seizures last for more than 5 minutes or patient do not become conscious within next 5 to 10 minutes, then patient should be immediately shifted to a hospital.
All right, Dr. Vengamaz, you could tell us now, is epilepsy a hereditary disease? And sometimes, there's fear in people's minds about it being contagious.
Yeah, epilepsy is not a contagious disease at all. You cannot catch it from somebody or you cannot transmit to somebody else by staying together, by playing or by eating together. As all of you know, epilepsy is a disease of brain because of abnormal electrical activity. Coming to the hereditary part, not all epilepsies are hereditary. There are certain epilepsy syndromes, certain specific types of epilepsies, especially idiopathic, generalized. They are running in families from one generation to another generation. Suppose if a father or a mother or a sibling has got an epilepsy, their chances of getting epilepsy may 2 to 4 times in the subsequent generation compared to a person who has no family history. Hereditary component, if you take it, it is only 1 to 4% of all the epilepsies, which are all those specific epilepsy syndromes like juvenile myoclonic epilepsy. Some types of absence, generalized epilepsies are only transmissible or runs in families. But good thing is most of them, these general hereditary epilepsies will not have any underlying structural reason. They respond very well to the drugs. Only thing, we may have to take little longer than a person who has little longer treatment compared to a person who has no hereditary basis.
All right. Dr. Lakshmi Narayanan, if you could tell us, can a person with epilepsy drive and, can a person with epilepsy marry and have children?
Guidelines on driving depends on the epilepsy type, the seizure frequency, and the individual circumstances. Say, for example, a person who is very well controlled on regular medication and had not had any seizures for the last 6 to 12 months is safe to drive. On the other hand, another person who has regular seizures monthly or so cannot drive. So the seizure control is the single most important factor we take into consideration for driving guidelines. So the patient should continue the medication without skipping any dose and have a very regular normal sleeping time periods. If they skip the medication, if they don't sleep properly, they will have a recurrence of seizures that will prevent them from driving for next 6 months. Coming to the second part of the question, any person with epilepsy can marry and have normal children. There are a few specifications and the cautions need to be exercised. Women with epilepsy on medications need to discuss with their neurologist and obstetrician before pregnancy planning. And while on pregnancy, while continuing anti-seizure medication, she needs to be regularly, closely followed both by the obstetrician and the neurologist for the well-being of both the mother and the unborn baby.
All right. And finally, I'd like to ask a question to all the panelists, one by one. If you could answer the question, what is your take-home message to the community and all the people with epilepsy? And Dr. Mehendi Ratha, first to you.
Yeah, thank you. Epilepsy is easily diagnosable. Gold standard is history from the patient and the witness. Prevention is the most important aspect, and we need to play a very active role on education and awareness about epilepsy. International Bureau for Epilepsy this time slogan is Stamp Out Stigma. And this is possible through print, electronic and digital media, especially the social media, which can play a very vital role. Thank you.
Dr. Rawat, to you next.
I think the important part is that you accept that you have an epilepsy. Once you accept, you become open about it. Tell your colleagues, tell your schoolmates, tell your friends that you have an epilepsy. So the constant stress and the stigma immediately goes away.
All right. Dr. Haldar, your message?
The most important message is epilepsy is treatable. It is just like another disease, and you have to control your disease rather than disease controlling your life. Taking regular medicines, and being in consultation with your doctor and ensuring that you lead a normal lifestyle can help in controlling the disease in most cases.
All right, Dr. Rathore.
So my single message to the community will be, please remember that epilepsy is eminently treatable disease. Majority of the patient with epilepsy can be controlled with medicine or surgery, and almost all the patients can live a completely normal life as compared to anybody else in the world. Thank you.
And, Dr. Vengama?
All the physicians who deals with these patients should also address and counsel about all the social aspects of the epilepsy, and that's where we have to educate and improve the awareness among the society about these social aspects they face during education, during driving, during marriage, all those things.
And finally, Dr. Lakshmi Narayanan?
Follow your treating doctor's advice diligently. Take the prescribed medications regularly without skipping any dose. Have adequate sleep and healthy lifestyle, and avoid excessive use of mobile devices and watching.
All right. Well, thank you so much, doctors, for joining us and sparing your time to help educate and create awareness around epilepsy. Thank you all for watching. Goodbye.